All right. Hello. Welcome to the National Shattering Silence Coalition's YouTube channel and podcast. And today we are joined by our coordinator of the National Shattering Silence Coalition, Jeanne Gore. Jeanne, hello.
Hi, it's great to be here, Eric. Thanks for having me.
And the National Shattering Silence Coalition, we focus on people that are often left out by the mental health community. When people talk about peer advocates, they say nothing about us without us. And what I like to say is nothing about us without all of us, because not all of us can serve on a commission. Not all of us can respond to an online poll. There's a lot of people left behind that are in prisons, homeless, that when they poll peers are not really being polled because they're homeless or in the criminal justice system.
Exactly.
And
Or they're too ill to be able
too
to
ill,
speak for
too
themselves.
ill. Yes, too ill to even leave their houses. And these are people that are often left behind. And I have an article out actually yesterday in the Treatment Advocacy Center talking about my own journey in recovery and how we need different levels of care. And the National Shattering Silence Coalition fights for all levels of care. So like if you're able to go to college and you have a SMI, which stands for serious mental illness, we want you to be able to go to college. If you can't leave your house, we want to make sure that you're taken care of and services come to you. We're not, I say nothing about us without all of us. And we have, and now before I get to Jeanne, one of our members, Lynn Nanos, wrote a great book, Breakdown: A Clinician's Experience in a Broken System of Emergency Psychiatry, written by Lynn Nanos. And if you like this interview, this podcast, this YouTube channel, you'll love this book. It's great. It talks about everything from an emergency psychiatry social worker perspective up in Boston. And it's just a great book. And now without any further ado, let's get to Jeanne. So Jeanne, where are you from?
Originally, I'm from Springfield, Massachusetts, and moved several places in between and wound up in Maine about 20 years ago. I'm in Shapley, Maine.
All right. And is that in the southern part of the state?
It is the southwest. So it's about an hour west of Portland.
Okay. So okay. And so and you're an advocate for your son.
Yes, I am. I'm his legal guardian. I'm his conservator. And yes, I'm his biggest advocate.
All right. And when did you when did you notice something was wrong?
Really, I didn't. It was hard to pinpoint exactly when this all began. He has a genius level IQ. He was the co-captain of his soccer team in high school. He was National Honor Society, top 3 in the state. Would have had a scholarship to go to college anywhere in the state of Massachusetts for free. And all seemed to be well until the summer after his high school graduation. He broke up with his girlfriend. He quit his job. He started just really isolating himself, not wanting to go out and hang out with his friends. We thought it was sort of, just angst, normal angst about going away to college. He was had decided to go to the University of Vermont in Burlington. And his first semester, he went to a counselor at school and kept calling me, complaining about feeling really depressed and having difficulty concentrating in his classes. And so that break in between semesters, I brought him to North Andover Neurological Associates in Massachusetts, and they determined that yes, he had a genius level IQ. He was, very bright. They thought maybe he had a touch of ADHD, but his biggest problem they felt was depression, which was why we brought him there in the first place. They wanted to put him on an antidepressant, but they didn't refuse to treat him until he agreed to stop smoking pot, which was something he wasn't willing to do. And I also worried because my mom had what they used to call rapid cycle manic depressive disorder. And I was afraid that if that indeed was what he had inherited, if they put him on a depressant, an antidepressant, would it make him manic? So he went back to school untreated. And that spring, we sent him to Florida. My niece was opening a restaurant, and she wanted someone to paint murals on her wall. I forgot to mention that he's also a very talented artist, and he had won Wang Center Awards for his artwork in high school. So we sent him down there, and on the third day he was there, he met a guy in a bar and he disappeared. And I started calling all kinds of people. I went to the police. I tried to report him as missing. They said, he's an adult. He's allowed to be missing if he wants to be. I said, but you don't understand. Something isn't right. It's not like him to just disappear. I started calling Sprint, my phone service, and I kept asking them if they could tell me where his phone was located, because his phone was on my plan. And they kept saying, due to HIPAA laws, they weren't allowed to give out that information. And I just kept calling. And I finally got a woman who had a heart. And I asked her what she would do if her child was missing. Would she look to see where her phone was last located, the last person she called? And she said she would. And so she helped me. And long story short, I found him in a jail in Carbondale, Illinois, and he was arrested. He was found there at 3:00 in the morning in front of some kid's dorm, just howling at the moon. And they couldn't get him to stop, and they couldn't get him to leave. And they hit him with a taser twice. They did a cavity search because they thought that he was just wasted. They didn't understand that he was having a psychotic break. And I called the jail. I called every jail. I guess I have to back up a little. I found out not only where his phone was located, but the last person he called, which was the girlfriend of the young man he left with. And she gave me her boyfriend's phone number, and he told me that he left my son in front of the University of Illinois. And Carbondale happens to be right there. So I called that jail and described him to them. And they said, that sounds like him. He doesn't have any ID. I got them a picture. My ex-husband, who was my husband at the time, went and got him. We brought him, when he came home, he said, Mom, I was raped. And I tried to explain to him that he wasn't raped, that even though it felt like he was raped, what they were trying to do, because they didn't understand that he was ill. They thought that he was just wasted. And I made him a nice breakfast, and I got him in the car, and I drove him to an emergency room. And he was clearly psychotic to the person examining him. He kept responding to voices that we couldn't hear. He was very upset. They hospitalized him for 10 days and let him go. He went back up to Burlington, Vermont. It was September. It was starting to get cold out. He had his own car and he was sleeping in the car. And I kept going up there trying to get him to a counselor or somewhere, trying to give him food, trying to get him to come to a hotel with me so we could take a shower. This was like 5 hours from my house. So I couldn't just stay there all the time.
Let me just stop you right there. What do you do for a living that you were able to, because a lot of parents I talk to, their biggest complaints, one of their biggest problems is they have to be at their job. They can't just stop everything and go to Vermont or go to Illinois. What do you do for a living that you're able to do that?
Well, I was fortunate because I'm a travel agent and I own a travel agency, and I have been working from my home since 1998. So I can literally take my work with me wherever I go, which is what I would do. I would bring my laptop. I would be on the phone, with customers or cruise lines or,
Okay.
whatever I needed to be in touch with while I was in the middle of my son's psychiatric emergency.
One of the things that families say that is the most frustrating is they want help for their son, but they want to protect their son's privacy. And that this is something that people struggle with, because if your son can't get help for cancer and you go out, have a public appeal, the insurance won't cover it, the service isn't available, no one's really going to think less of, going to really discriminate against your son. But mental illness, it's very hard for, so I mean, I understand why you're doing this, but explain explain how that was hard to speak out and advocate for your son.
Well, I personally, I never had a hard time speaking out to healthcare professionals about it.
Mm-hmm.
I wasn't ashamed of him in any way, shape, or form. I just wanted someone to help him because I knew that somewhere inside that psychotic mind that had taken over, my son was still there. And so I didn't have a problem speaking out to those people. I did have a problem with friends. I lost a lot of friends who couldn't understand why I was fighting so hard for him. They said, I think because they did not really have an understanding of what a serious brain disorder really is. They felt like some of this was in his own control, and that, if he wasn't seeking help on his own, then I needed to just let him go and let the chips fall where they may. Because people don't understand that the very nature of this illness, at least in my son's case, and in roughly 50% of all cases of people with schizophrenia or bipolar disorder, they also suffer from anosognosia, and which is a neurological disorder that doesn't allow them to know that they're sick. And
yes, and that is very common.
Long time to grasp.
Not just with, I've noticed this with a lot of just people in my life, that they can't really, it's too much for them to wrap their heads around. And at a certain point, you just got to cut them loose. Like, okay, I don't want them. And it's very frustrating when you get people like this in the medical community, or especially in mental health, that are all about self-directed care.
Yes,
like,
because they're the ones who should know that if you are suffering from anosognosia, you cannot see that you're ill. It's not about denial. It's not about being stubborn. I had an ACT team leader once tell me, when my son was at a group home and he was just living in squalor. Because you were supposed to be able to feed yourself. He couldn't feed himself, couldn't take care of his room. I had an ACT team leader tell me, you know, when he gets hungry enough, he'll take the medication. It blew my mind, because if you are suffering from anosognosia and someone wants you to take this medication and you think you're a shaman, and you're fasting for 40 days and nights, and you don't believe that you're sick, there's nothing wrong with you, why would you take it?
Yeah, and there's another thing though. I think I question how much that person on that ACT team would want someone like her son on his caseload.
Um,
I sometimes I wonder if it's not, if it's like they say that person with anosognosia is stubborn, and I wonder how much of this is stubbornness and how much of this is we just don't want to deal with it.
I think in his case, that may have been part of it, because they do have limited resources. And my son in his case, in that particular moment, was very high maintenance, because he was completely psychotic, and they were having trouble with him at the group home. He was very agitated. He was pacing 24/7. I'm sure that that was part of it, but the other part of it was that he simply had never been trained to even believe that anosognosia exists, that it is truly a medical condition. He was not aware of that problem. When I explained it to him, he said, "Oh, come on, Jeanne, come on. You know, of course they know. Somewhere in their hearts of hearts, they know that they're
Yeah.
sick." I had to show him. I brought him in the book, Xavier Amador's book, I Am Not Sick, I Don't Need Help, or I Do Not Need Help. I brought that book to him and I begged him to read it.
But also though, like I said, I believe a lot of, maybe not him personally, but the person that did his training. Like you look at everything under the sun is in the DSM-5. Anything and anyone you could possibly bill an insurance company is in the DSM-5, but anosognosia. That's like the only thing that's not in there. And I think a lot of it is a lot of clinicians. I don't think, like for instance, when they discharge someone from the hospital, they'll talk about services in the community are cheaper, but they're going to different types of patients.
Yes.
And that's something that they compare apples and oranges, but that's a conversation for another time. And okay, and explains and talk about what happened in Burlington, Vermont.
So that September, when it was starting to get colder outside, there were these people who work in the community. I used to call them street angels. They basically were there to hand out peanut butter and jelly sandwiches, sleeping bags, you know, trying to help the homeless community, which was largely made up of young college-aged kids, because it's a college campus, who were just like my son, who were suffering from serious brain disorders. And so I got in touch with them, and they kept, you know, every day I would call them, and before going up there the following weekend to have you seen my son? Is he okay? And they called me one afternoon to alert me to the fact that he had apparently gone into a restaurant and ordered a piece of cheesecake and then went to use their restroom. And they would not let him use their restroom because he was so filthy. And he became really upset and agitated, and he started smearing the cheesecake all over the storefront windows. And they, instead of calling the police, called the street angel people. They came and got him and started walking him back towards the park, if you've ever been to Burlington, which you probably haven't, there's a big park behind all the stores on Main Street. And that's where all these people would hang out. And so when they got him out to the park, he said to me, when he called me, don't worry, I'm just going to get him to do something, even just the slightest bit aggressive towards me. And then I'm going to call the police and they're going to come and they're going to bring him to a hospital and get him help. Well, unfortunately, his plan backfired, because what he did was he kept taunting my son the whole walk back to the park, kept saying things like, look at you, you're so filthy. Nobody's going to want to date you. Nobody's going to love you. Nobody's going to want anything to do with you. And my son, after listening to this for a while, apparently spit on the street angel's shirt. And that's when the police were called. And, one or two officers with billy clubs and rubber gloves on first approached him, and then it became 7 officers, and they asked him to stand up. He was sitting on the ground and he couldn't, because he was afraid. And then they started hitting him with the billy clubs, and a crowd had gathered around the scene and everyone was yelling at the police to stop, but they wouldn't stop. And eventually, I guess when he stopped moving, they stopped beating him and they brought him to jail. The street angel called me back again and told me what had happened, and I drove up there. And the next morning, they brought him to the courthouse, and they, told the judge that they were pressing charges for assault and battery. And I stood up and said, whoa, wait a minute. You can't do that. And the judge, bless her heart, she at least she let me speak. And I told her that I was his mother and that he had been in a fetal position on the ground in the park, and there were witnesses, and they watched the police beat him up. And instead of bringing him to a hospital, they brought him to jail. And that I knew for a fact that one of the officers had inadvertently hit another one with a billy club, and somebody else got sprayed with pepper spray. And those were the only 2 people besides my son who had been injured. And I demanded that they bring him to a hospital and drop the charges, or I would be pressing charges against them. And they did. They brought him to a hospital. They took many photos of him. He had broken ribs. He had a concussion. We never did press formal charges, because in order to do that, my son would have had to testify, and he wanted to live in that community, and he was scared to death, and rightfully so, of the police. And so we never pressed charges. And thankfully, he had a really awesome psychiatrist there, Richard Munson, who really cared about him. And
also, they're hopefully in Georgia and other states, they're trying to change the dangerous standard to gravely disabled. And it would have been nice if the street angel could have had, say, a street social worker come out and evaluate him and get help without getting the police involved.
oh, absolutely. I mean, they unfortunately, I don't blame this on the street angel, because those were the only options they had. They didn't have, I mean, this was a long time ago. I don't know what Vermont has in place right now, but they did not have access to a case manager or a social worker.
And even if they did, what would the case manager have done if they're saying, oh, well, he has a right to be homeless, but then no one wants to go to that restaurant because he's out there, and that is unfortunate. Like I said, he's a human being. But unfortunately, when like me, when I'm not on my meds, people kind of stray away from me. And
Yeah,
I'm
when
able to,
we,
yeah.
right,
And the
when we
thing though
wait for
is if
somebody
you're
to,
gravely disabled out there and you're it's gonna get cold, I mean, there should be a way where they could the authorities can intervene without spit on my shirt so I can call the cops.
yes,
And
they
that is something,
deserve the same compassionate
yeah,
care that we give to, for example, somebody's grandmother or somebody's
yeah,
grandfather who's suffering from dementia and they've somehow, walked out of their house in the middle of a snowstorm or whatever, and they get found in the street disoriented and confused, and they're not brought to a police station, they're brought to a hospital. And their family members are contacted,
yeah,
which
their family members are
doesn't
contacted
happen with
and their
us.
family members are not treated everyone wants to get the family members involved until they speak out about the care not being provided. Then it gets pretty, yeah, but the family members are treated much more respectfully when it's someone with Alzheimer's.
Yes, I took care of my mom for 11 years and no one ever said anything about HIPAA or asked her to sign a release, which is ridiculous in the first place, to ask someone who lacks the capacity to even, know where they are or what day it is, to have them sign something that says you can talk to them is ridiculous.
Yes. And all right. And Jeanne, have you had any interaction with Pammy?
Oh, yes, I have.
And what does Pammy stand for?
That's protection and advocacy for people with for individuals with mental illness. My interactions with them have been both as a guardian and parent, and also as an advocate. The first time I became aware of them was one of my son's hospitalizations. He was very ill and he was in Vermont, and he was refusing medication, and I wasn't yet his guardian. And they sent someone in there from disability rights who was coaching my son for the right words to say that would get him released from the hospital. And that was my first interaction with them. That happened again many times in the state of Maine. The most, I think, shocking one to me was that the person who used to be the director of disability rights in Maine, Helen Bailey, used to show up in court every time we were trying to get AOT legislation passed. And she had a bunch of consumers with her who I felt truly sorry for, because they were obviously not well, but well enough to memorize whatever she wanted them to say. And they would go in there and testify against AOT because she had scared them enough to make them think that that we were trying to get AOT so that we could just lock them all up, which was not at all what we were trying to
Yeah.
do. So I asked the committee chair. She had her office. I had just called her office a couple days before arriving at the courthouse for this testimony, because I wanted someone from her office to go in and investigate the PNMI bed. It's a private institutional setting boarding house, where my son was, because he was living in squalor. And instead of going to investigate that problem, she showed up in court to once again lobby against this bill. And I asked the chair, I said, excuse me, I don't remember what his name was, to be honest. It's been 10 years. But I asked him if he would please ask her to leave the courtroom because she was there lobbying. She's not being paid to lobby. She's being paid to protect and serve people with disabilities. And he did ask her to leave. But 9 times out of 10, this is not the case. This is not what happens. They're just, there's no one stopping them from doing it.
All right. And was NAMI in Maine ever helpful?
No. I went to one NAMI meeting and I was very frustrated at that meeting because it was very clear to me that at that meeting, all they were doing was commiserating with one another. No one was talking about how do we fix this? How do we get help for our children? And then my interactions with NAMI when we were trying to get legislation passed were often adversarial as well, because the director of NAMI Maine, who is no longer the director, thankfully, did not believe in AOT under any circumstances ever, or in voluntary hospitalization under any circumstances ever. So no, NAMI was not helpful, and I tried to bring it to the attention of NAMI National several times. And their statement to me the last time I tried to get them to do something about the fact that their affiliate in Maine was not abiding by their national policy, what their statement was that they allow their affiliates the freedom to write their own policies.
Okay, because I've heard different things when you do things they don't like in the pro treatment area.
There are wonderful NAMI organizations all over this country. There are wonderful ones.
Yeah.
I mean, for example, Leslie Carpenter, our policy action chair, her NAMI is great. There's NAMIs in California that are great. The problem is that NAMI National seems to be, they seem to have lost their way when it comes to helping the most seriously ill population that they're supposed to be representing, and their families.
NAMI Georgia is great, but yeah, I've heard horror stories about NAMIs, and it seems to be mostly in the Northeast, like north of Virginia. They really don't. I've heard, I mean, New York, I've heard good things about, but like a lot of Massachusetts, a lot of states up there, NAMI just doesn't seems to have a lot of been taken over by antipsychiatry.
Yes.
People.
Yes.
Antipsychiatry, and I would say clinicians that don't want people like myself or your son on their caseload.
Right.
I think that's pretty much
and
okay.
It's really too bad. And it's not, it's in my humble opinion, it's really, it's not right, because they are federally funded, and they get grant money, and they're not doing what they're supposed to be doing.
Well, I think the grant money is what corrupted them. I think they want, if you want SAMHSA funds, you can't bump heads with the hand that feeds you. I think it's all, we could talk about SAMHSA forever, and SAMHSA, I believe, is the Substance Abuse Mental Health Administration. There's DJ Jaffe wrote a great book. The late DJ Jaffe wrote a great book, Insane Consequences: How the Mental Health Industry Fails the Mentally Ill. And it's, yeah, I like I said, my family, I wouldn't be here without NAMI Georgia and our great affiliates. And can you explain what assisted outpatient treatment or AOT is?
Sure. It's, excuse me, the laws vary from state to state, regarding who can petition the court, and what all the pieces of the AOT program is, but it stands for assisted outpatient treatment, and it's really intended for in a large part for people like my son who have no awareness of their illness and who get caught in a revolving door, just in and out of the hospital or in and out of jail, because whenever they're sent back into the community, they stop taking their medicine, they stop following their treatment plan, and they wind up, back in trouble. And so the idea is, for example, in Maine, they call it the progressive treatment program, and a guardian, a police officer, a doctor, an ACT team, or a hospital they write up a treatment plan and they present it to a judge, and a judge will either approve or deny it. The person is entitled to and does have their own lawyer. They can contest it, and then the judge decides to do it for either 6 months or a year, and then you can always go back and get it renewed or ask for it to be dissolved. And that's pretty much the way it works all over the country, with, some differences in who can apply and the time limits for the program. It is what saved my son's life.
It's saved a lot of, on a previous podcast I did, Eric on the Last Taboo, I interviewed Eric Smith, who now works at the Treatment Advocacy Center, and he's doing great. And he attributes AOT for saving his life.
He is
and
a
lot of
wonderful person. And just think, if he hadn't been given that opportunity, we wouldn't have his voice. And, for my son, it was 43 hospitalizations, 2 stints in jail, homelessness. All of that came to a screaming halt when we finally got AOT for him. And that was in 2013. And ever since then, he, with 2 minor exceptions where he had to go back to the hospital for a medication adjustment, and it was a very brief stay, he is happy in the community and living independently, and life is good.
Well, that's great to hear. And Jeanne, I want to thank you for coming on and sharing a very personal story that a lot of people that watching this will relate to, and hopefully people that don't have a loved one with a serious mental illness will also relate to and want to help. But also, the National Shattering Silence Coalition has some stuff that we're advocating for currently. Would you be able to elaborate on some of the stuff that we're advocating for right now?
Well, right now we're doing a few things. We're really concentrating on trying to gather families and people with lived experience and professionals in the trenches stories, either through our blog committee, or we actually have a couple of videographers who have volunteered to help us if people want to do it the same way we're doing it right now. Because it's important, it's so important for other people to hear our stories so that they can understand more about what it's like to have one of these illnesses, what it's like to be trying to get treatment for someone. That's one project we're working on. We're also, we're putting together a few calls to action for several pieces of legislation. The most important one at the moment is HR 2611, which is sponsored by Grace Napolitano, and it's
And
to
Grace Napolitano is the Los Angeles metro area congresswoman from
correct,
California.
correct. And it's basically, although there's a lot of other things in the bill, it's the gist of it is that it would repeal the IMD exclusion. So that's a big one. And there are two other bills, and I'm sorry, I don't have them in front of me, and I was just made aware of them recently, that will have to do with getting more services available nationwide for people when the new 988 number gets rolled
Yeah.
out in July.
The 988 number is, I mean, I'm glad it's out there, but I thought it was interesting. You call a number and they tell you there's a waiting list. They're going to have some money, some more services be made available, because a lot of times it's
Yeah,
not like you get a hold of a social worker and like, I'm sorry, but there's no bed available. There's no AOT. There's no.
well, that's something that we're all, I think, that everyone's aware that this is a problem.
Yeah.
And it's really, it's a good thing in a way, because it has galvanized all the mental health professionals and people all over the country have been getting together to think about how do we get all of those
Yeah.
services in place. I know I'm on a committee right now with NAMI National.
So you are on a committee with NAMI National.
I am on a committee that is talking about this very issue, to try and come up with recommendations for how we can make our country more able to handle these kinds of emergencies without involving the police. I'm on a committee in Maine that's trying to do the same thing, and I know a lot of our other committee members are active all over the country trying to
Well, that's good. And like I say, I hope these services do get available. And I know a lot of clinicians do a lot with what they have, and I don't want to be over. And like I said, and all right, well, thank you very much for coming on. And once again, if you want to see a clinician that is working hard for families like ours, check out Lynn Nanos's Breakdown, a Clinician's Experience in a Broken System of Emergency Psychiatry. Lynn is on several of our committees, and she talks a lot about the struggles that clinicians go through. And we just heard about a courageous mom and some of the struggles she goes through. And please come to our website, which is
National Shattering Silence Coalition.org. And thank you, Eric, for having me.
Oh, thank you. And come check us out. And we would love to have you join or share this video. And thank you very much.